Welcome to Knees in Balance, a holistic approach to managing knee pain. My name is Dr. Tina Schaffner, and I'm a licensed physical therapist at Neil King Physical Therapy. Today, I'll be guiding you through some simple stretches and exercises to help alleviate your knee pain. Before we begin, let's talk about knee pain. Understanding knee pain is crucial for managing and alleviating discomfort effectively. It's important to recognize that knee pain can stem from a variety of causes, including injury, overuse, or underlying conditions such as arthritis. The knee joint is complex. Its structure comprises of bones, ligaments, tendons, and muscles that all must work harmoniously for optimal function. When any part of this intricate system is out of balance, pain can result. Factors such as muscle imbalances, poor posture, lack of support, or improper movement patterns can also result in knee pain. By identifying the root cause of pain, we as physical therapists can tailor a treatment program that's specific to you. That program includes manual therapy, stretches, strengthening, and movement reinstruction to promote healing and prevent future injuries. Education on proper body mechanics and lifestyle adjustments are also a key factor in recovery and managing your overall long-term knee health. It's important to listen to your body and seek medical advice if your pain persists or worsens. Today, I'm happy to be joined by my fellow team member, Dr. Becky Pace. Together, we want to show you some simple exercises that you can do to start alleviating your knee pain. We're going to go ahead and get started. So these are some basic exercises that you can do pretty close to after an injury, or if you're just starting getting exercise. First thing we're going to do is a quad set. The quad is the muscle that's on the front side of the thigh. And what we're going to do is just tighten that muscle. So you can see how when Becky tightens the muscle by pulling her kneecap up, this muscle on the top of the thigh will flex, and then she can relax. Sometimes you will see people have towel rolls below the knee. The problem with that is if you're pushing using your butt muscles or your hamstrings, that might make your quad set not as strong. So what you're looking for is to tighten the top of the thigh. You may actually feel your heel lighten just a bit. You're gonna hold that for 10 seconds and do about 10 repetitions. From there, we can move into heel slides. This is to start getting that knee joint moving. It helps move the fluid around the knee joint. You're gonna slide the heel up and slide the knee down. Inside of our joints are not well vascularized, meaning they don't have a good blood supply. So we really need movement to keep the nutrition coming in and coming out of the joint. From here, we're gonna do a straight leg raise. So once again, Becky's gonna tighten her thigh. She's also gonna tighten her trunk because if somebody's got underlying back pain, we wanna make sure that we're supporting the trunk as well. Tighten, and then go ahead and lift that leg up to about the height of this knee and lower back down. And she's gonna keep that thigh muscle tight the whole time, assuming that she's got the endurance to do that. If you need to reset in between each rep, that's fine as well. Working up to about 10, 15, maybe even 20. And it's just lifting and lowering, making sure she's breathing and keeping her core stable. Next we're gonna do is bridges. So bridges are designed to engage the glutes, or the muscles on the back of the hip, which help to support the knee. So same as with the straight leg raises, we're gonna engage our trunk to support our trunk. She's gonna tighten her gluteus muscles, which is her butt muscles, and lift her hips straight up towards the ceiling. And you can see her knee, her hip, and her back are all in line. She's one straight line. Then she's gonna lower down through the hips. Notice she's not dumping through her spine or flattening her back into the table. We want those back muscles working a little bit to keep the trunk stable so she's nice and supported. From here, we're gonna move on to the side muscles of the hip, which also support the knee. So if you go ahead and lay on your side there, Becky. These are called clamshells. Once again, protecting the spine, belly muscles stay engaged, and she's just gonna lift the top knee as high as she can and then lower back down. A common mistake that we see is people will roll backwards because they've lost trunk support. Each exercise that you do is only as good as the technique that you use. So we wanna keep this form clean, belly muscles stay engaged, glutes are working to lift the knee and come up and down. Again, 10 to 15 repetitions. From here, we're gonna move into a little bit harder exercises standing on the side of the table. We're gonna start with step-ups. So you can use a bench in your house, you can use stairs if you've got a platform, either way. This step is about 18 inches off the ground. You might need to start with a 4-inch step. Stopping here, the keys to this is she's keeping her knees in line, and when you look at her from this angle, there's no wavering. So when she looks down, as she puts the weight into this leg to step up, This leg is staying rock solid, which means that the forces going through the knee are nice and symmetrical. Belly muscles in and coming up and down. Now we're gonna do calf raises so we can get the lower legs. You might need something for balance. We don't necessarily need to be challenging balance and strength at the same time. And she's coming all the way up onto about the second toe and lowering back down. We want to keep the knees locked out if you want to get the gastroc, which is the muscle in the back of the knee that supports and goes over the ankle and the knee. You can do this same exercise with the knees bent and then going up onto the toes, and that gets some of the smaller muscles that don't cross the knee. Last one we're going to do is a sit to stand. We also call these a squat. So the same action that you do for a squat is how we get in and out of chairs every single day. So she's just gonna drive her hips back and stand back up. You might need to take a rest after each repetition and then stand back up. As you get stronger, it might be as simple as a butt tap. What she's watching here is to making sure, once again, her knees are tracking over her toes. She's not becoming knock-kneed where the knees come in, or going onto the outside of her feet where her knees would flare out. We want to keep those knees tracking straight ahead. From here, we're going to move on to some stretches. So you can use a dog leash. We're going to use a monster band here. We use seat belts oftentimes in the clinic. I'm just going to help her here. And this is going to stretch her quad. Now, oftentimes you will hear that the IT band is contributing to knee pain. The IT band is a ligament that's designed to give a lot of stability to the outside of the knee. It is a ligament. We don't oftentimes stretch ligaments, but what we can do is we can stretch the muscles around them. So the IT band sits on top of what's called the vastus lateralis, which is an outside quad muscle. So if we stretch that muscle and keep the knee in line without allowing it to splay out to the side, we can also influence that IT band, and I found much better outcomes with this method. She's keeping her abdominals tight, she can keep her butt muscles tight, and she'll feel the stretch along the whole front side. If you're very tight, you might only make it to here. We're not gonna pull. We want a mild to moderate stretch with no pain. So that does the front of the knee. Now we're gonna flip and do the hamstring. What's nice about using the strap is we can make these stretches static, which means you're just holding the stretch. Or if you're doing it before a game or before some outing, you can do them dynamically, meaning you're instituting some movement. So from this, you can notice she's got a slight bend in her knee, and she can feel the stretch from her knee down to her buttock muscle. If you're getting any discomfort in the calf, that could be related to some sciatic nerve issues, so I'd recommend that you maybe do a little bit less at the knee or give a little bit more and maybe pull the leg closer to the head. So same thing, those of you who might have a history of back pain might want to be careful with this one because it also can put a little stretch in the sciatic nerve. The goal is to feel this one behind the calf. And then last but not least, we'll do the single knee to chest. So go ahead and lay down. This one's another nice range of motion where she's just gonna pull. You can pull on the outside of the knee. You can pull behind the knee. The nice one about this is it's a good way to get hip flexors on the opposite side in a gentle way. These exercises and stretches can help improve flexibility and alleviate knee pain. Always perform exercises in a pain-free range of motion and consult a healthcare professional if you have increased pain, worsening pain, numbness or tingling, or any changes. Remember, consistency is key. Incorporate these exercises and stretches into your daily routine, and don't hesitate to reach out to a healthcare professional or a licensed physical therapist for personalized guidance. Thank you for joining me today, and I hope your Knee and Balance series brings you relief and contributes to a healthier lifestyle. Stay tuned for more tips on how to lead a pain-free life on our channel. Click the link below to schedule a free wellness evaluation at one of our 10 Southeast Michigan Neil King Physical Therapy locations.